Hundreds of thousands of our military heroes are back from war only to find themselves on the front lines of a new battle at home.
Nearly 1/3 of all vets suffer from PTSD, post-traumatic stress disorder. But a Chicago area doctor has helped develop a unique treatment for that. Jan Jeffcoat is here now with the story. Jan.
Bob and Robin, the treatment is called a Stellate Ganglion Block, and it's simply a shot in the neck. Certainly sounds simple because it is, and that's what also makes it very controversial. I recently spoke to this doctor and followed 2 vets who underwent this trial procedure to see if it worked for them. In these snapshot memories, James and Kateri Peterson look like they have the ideal happy family. But come a little closer, pictures don't always tell the story.
He's just not happy, and nothing is fun anymore, and it's just ruined him.
James was diagnosed with post-traumatic stress disorder in 2007 after returning home from serving in Iraq. Since then, he's been fighting his own war inside his mind.
I was hyper-vigilant. I would always make sure my apartment doors were locked, the windows were locked. I'd avoid crowds a lot.
James was taking 10 to 15 pills a day for anxiety, depression, and pain, affecting his marriage and 3 young sons.
Our oldest kid has secondary trauma, where he now will sit in a restaurant facing a door, counting exits. He does all that kind of stuff.
Fellow combat vet Eric Fowler also suffers from a severe case of PTSD. He served 2 tours of duty in Iraq and one of the most dangerous missions, scouting enemy targets.
A lot of times I'll find myself at home for, all day or almost 2 days, not really going anywhere.
Both Eric and James hope an innovative treatment that was initially used for basic pain management can now be used to treat symptoms of PTSD. Chicago area doctor Eugene Lipov with Oak Brook Surgical Center believes injecting the anesthetic bupivacaine into a bundle of nerves in the neck could actually block pain signals from reaching the brain.
When somebody sees a traumatic event or something bad happens to them, a certain part of molecule gets secreted in the brain. That molecule makes a certain type of nerve, sympathetic nervous system, gets overly activated, and the new nerves actually grow. When I do the shot, this new nerve growth goes away. It's like rebooting the brain to what it was like before the trauma.
The procedure itself takes just 10 minutes. Dr. Lipov uses an X-ray to guide the needle and target the spot.
You good? Mm-hmm. I'll be done in a sec. There's some pressure on the neck. Mm-hmm.
Dr. Lipov has used the treatment on 30 vets so far with promising results, but it's been a hard sell for the U.S. military, which so far has refused to pay for Lipov's proposed $1.6 million clinical trial. In fact, a report in the military's own newspaper, Stars and Stripes, shows Army medical researchers were, quote, concerned Lipov's study was overly ambitious and expensive for a relatively untested concept and lacks a convincing neurobiological explanation. Dr. Stephen Hobfall agrees. He heads the Department of Behavioral Sciences at Rush University Medical Center.
I think it's too expensive in a study. Our success rates through psychological behavioral treatment are probably 80 to 90% successful. The difficulty is that some people don't want to go into psychological treatment.
Even if the military's not buying it, Eric is. He's already feeling dramatic results just 30 minutes after the procedure.
It just started kind of gradually just feeling better off than I was when I came in here.
James, on the other hand, did not initially feel any differently, but that all changed just 24 hours later.
Last night we went out for dinner, and that's the first time I was able to enjoy her company for 2 hours without worrying about who's walking in the door. Kind of weird. It's kind of hard to get used to.
And so far, Eric and James are doing well, and it's important to note that Dr. Lipov does not look at this treatment as a first line of defense for PTSD. He sees this more as a last resort after a vet has gone through the other treatment options, and nothing seems to be working for the patient.
Okay, so his experiment is too expensive according to the military. How much does it cost?
$1.6 million. That's what he has proposed to the U.S. military.
A person to get the shot.
Oh, $1,000 for one shot. But for the clinical trial, which is what he's trying to do, so they have a control group, that would cost $1.6 million.
Then you'd have a bioscientific explanation,
Exactly.
which is what they want.
Exactly.
Any hope for that?
Well, they're looking into it, and every day there's more promise, with the shot. So, and also it lasts between 1 and 3 years, depending on the patient, of course. So far, one of his patients had it one time, had to go back 3 months later and get another shot, and it lasted 3 years so far.
Step in the right direction.
Yeah, for
Thanks,
sure.
Jan.
Sure.